A dairy-free diet is followed when you're allergic to the proteins in dairy. This short film shows dietitians discussing a dairy-free diet and explains how this differs from a lactose-free diet. If you think you may need to follow a dairy-free diet, please ask your doctor or specialist nurse to refer you to the dietetic service. When you're referred to us, you will be offered a clinic appointment to discuss dietary changes with a registered dietitian.
Hello, I'm Jenny. I'm one of the dietitians at County Durham and Darlington NHS Foundation Trust.
My name's Nancy and I'm one of the paediatric dietitians.
We're going to talk today about a dairy-free diet. So Nancy, can you tell me what a dairy-free diet is?
Yeah, a dairy-free diet's a diet that's completely free from milk and milk products, but you can have eggs.
And when we're talking about milk, is it cow's milk that we're talking about?
Yeah, it's cow's milk. It's all milk from mammals, so it's cow's milk, sheep's milk, buffalo milk, goat's milk.
Okay, so anything that people might think they could try if it comes from an animal?
No.
The answer's no?
No.
Okay. What sort of patients would we see who would have a cow's milk allergy?
Well, there's a variety of patients, so there's a lot of babies are milk free. They usually grow out of the allergy before the age of 5. Breastfeeding mums have to be milk free as well if they're feeding a milk free baby, and some adults are also allergic to milk.
When a mum's breastfeeding, what passes across in the breast milk? Why does she have to be milk free?
It's the protein from the cow's milk that passes across. Lots of people get confused and think that lactose free will be okay, but the cow's milk protein's still in there, so the baby will still react to that.
So babies, we're talking about them being milk protein free. Yeah. So if anyone comes and asks if they can be lactose free, the answer's no.
Yeah.
Okay. Lactose free, is that something that we would see elsewhere as dietitians?
Yeah, we see it. Some babies can be lactose free, but it's very rare. It's more in adults. So lactose is the sugar that's in the milk, and people are intolerant to it. It's not an allergy, so they can tolerate small amounts of lactose. Whereas a cow's milk protein allergy, it's the protein that you're allergic to, so you can't have any of it. It's really important that your diet contains no dairy.
And if you're lactose free, what products would we recommend that somebody has?
If you're lactose free, you can have any of the cow's milk protein free that we're going to go on to talk about, but also you can buy the lactose free milk, lactose free cheese, lactose free butter from the shops.
So for the very small amount of babies that we see that are lactose free,
yeah.
When we first see them, what sort of milk would they be on?
When we first see them, they'd be on lactose free.
And would it be a prescribed formula?
Yep, they can be on a prescribed formula or they can be breastfed as well.
And then as they move away from that, as they get bigger, they'd be onto the bought lactose-free brands.
Yeah.
So with adults, if they're going to be milk-free, what sort of milks would we recommend for them?
There's lots of different milks and you can try them all as well because they all taste a little bit different. There's soya milk, so you could have soya milk, oat milk, and then there's lots of different nut milks as well, so coconut milk, hazelnut milk, all of those things.
And do these contain calcium? Because dairy is one of our big forms of calcium.
Some of them do. You just need to check the labels, and usually it says on the bottle or carton that it's calcium enriched, so oat milk's quite good for that, soya milk's quite good for that as well. Would
we say that children can have soya?
It depends. With milk allergies in children, it's quite a high percentage of the children that react to milk will also react to soya, so you can try it with them, but maybe not.
So if we had a baby who came to clinic, yeah, and we know their milk allergy and mum's been trying them on soya and they're really not very well, what would we say? Practically, what would we give the mum as advice? You would just ask the mum to exclude soya for a few weeks to see if this made a difference to the baby's symptoms. And if it did, then to keep the baby soya free as well, but if it didn't, to come back because we'd need to look to find out what it was causing the problem. So the milk-free diet, what are we going to say to a mum to avoid? So you need to avoid milk and all milk products. So milk products is cheese, butter, ice cream, all of those sorts of things. Yogurt? Yogurt. You can have fruit, vegetables, meat, pulses, all those things as they are on their own. But when you start adding things, when food's processed, quite often milk's added in then too. So things like ham and sausages, fish fingers. So then it's really important for mums to check labels. So if they're checking labels in a supermarket, are things going to cost more money if they're looking for fish fingers or chicken nuggets or sausages that are milk free? Not necessarily. There's a lot of free from products in supermarkets these days, and they are milk free, but they're very expensive as well. But if you have a look at the supermarket own brands, a lot of the time they're milk free just naturally. So it's just label checking. And if we're looking, we've been talking about savoury foods, are there supermarket-owned brands that are sweet foods that might be suitable?
Yeah, so biscuits and cakes and things like that, the supermarket's own brands, they can be milk-free quite a lot of the time as well.
So probably the big meals that people would worry about then, from what you've been saying, would be breakfast and pudding.
Yeah.
So breakfast, how would you recommend someone has a milk-free breakfast?
Milk-free breakfast, it's exactly the same. They can have cereal or toast, but you just need to use a milk alternative, that's all.
And with toast, what sort of bread does someone have? Because I know people are often anxious that they need to have dairy-free bread, that they need to make their own bread.
No, not at all. Most breads are fine on their own, and actually some of the 50-50 breads are quite heavily fortified with calcium, and as the person's milk-free, they won't be getting calcium from milk, so it's quite useful.
Yeah, so for breakfast, you could easily have a 50-50 bread with some dairy-free spread.
Yeah.
Yeah. What about puddings? Because we traditionally think of puddings, especially for children, as being yoghurt, ice cream, custard. What would you say?
Well, you can make your own of a lot of those things. So you can make your own rice pudding, or you could make your own custard. But again, with the custard, you need to check, because not all custard powders are milk-free. I know some of the big brands are, but just making sure that people check labels, and just make these with a milk alternative. So with usually a nut milk's better for that, because oat milk tends to go thick and clump up a little bit.
So it would be a little bit like porridge, the way porridge would thicken. Is that what happens as you cook with it?
Yeah, that's what sort of happens with oat milk. You can see actually, because we made some jellies, one with coconut milk and one with oat milk. So you can see here, this one's with coconut milk, and this one's
got coconut milk, and it's a fantastic colour, isn't it?
Yeah.
But you can still see the milk inside it.
Yeah.
So it's a little bit like a blancmange, but a jelly.
Yeah.
And I suppose corn flour is absolutely fine for milk allergies.
Yeah.
So people could try and use the coconut milk or a nut milk to make a blancmange.
Yeah.
And then this one, what have you made this one with? Because this
one's-
looks really different.
This one's made with oat milk, but you can see it's sort of clumped and separated out a little bit, which is fine in something like this. But if you're making custard or rice pudding, it's not so good.
You wouldn't want it.
No.
You wouldn't want it
No.
like that. What other things can people make that would be milk-free?
Almost anything that you can make with milk, you would just use the milk alternative. So macaroni cheese, you can make a white sauce with a dairy-free spread and a milk-free milk alternative.
And if you're going to try and find a dairy-free spread, would you find them in the supermarkets, or would we need to go to health food shops? Where would we direct people?
You can just find them in the supermarkets, and a lot of the supermarkets have their own dairy-free brands, but sometimes these are soya-based. So if you've got a little child or anybody who's reacting to soya as well, just making sure you check labels.
With calcium, are there any tips that you would give for making sure people can get calcium?
Yeah, I mean, obviously calcium's in milk, so that's where we would get most of it. So it's just making things like this and making desserts, but also there's 50-50 bread. Like I said, a lot of the children's cereals are quite heavily fortified with calcium. You can get calcium-enriched orange juice actually, but you could have a look on the BDA Foods Fact website. There's a good diet sheet about calcium on there.
So that would be really helpful for people to go and look at it. And with babies, when we first see them, would they be on one of the replacement milks, or would they be on a prescribed formula? What would happen?
So like any other baby, so a baby who wasn't allergic to milk, after they were breastfed, they wouldn't go straight onto cow's milk. It's the same with milk-free babies. They wouldn't go onto a milk-free substitute straight away. They would go onto a milk-free formula that would be prescribed by the GP, and that's just because baby formula contains lots of vitamins and minerals and other things that they need to grow, and so the milk-free formulas, they're exactly the same.
And if a mum's breastfeeding, there's no need for her to stop breastfeeding as long as she would follow a dairy-free diet.
She just needs to follow a dairy-free diet, yeah.
And she might need calcium supplements herself from the GP, mightn't she?
Yeah, she probably would, because a breastfeeding mum's calcium requirements are higher to start off with, and then if she can't have calcium from milk and things like that, then she probably would just need a little supplement.
What advice would you give to parents when they bring a baby in who need to reintroduce milk, if they're at a point where the doctors have said that they can have milk again? What would you do?
It depends, because there's two different kinds of allergies, so it depends whether it's the kind of allergy where they're allowed to do the milk reintroduction at home or whether they need to be in the hospital to do it. So I'd ask them just to come and speak to their dietitian.
And if they're not currently referred to a dietitian, they should ask their GP or specialist nurse or consultant to refer them to us.
I wouldn't do it at home on your own.
Okay. Are there any key things that have got milk in that sort of catch people out? I know one thing that I always think about is chocolate. Because dairy, you can't have milk chocolate, but you could have very plain chocolate.
Yeah.
Because very plain chocolate, is something that's sort of about 80% cocoa and above, won't have dairy in it. Is there anything you can think of like that that's slightly odd?
Things like ketchup. Ketchup can have milk in sometimes, and some of the meats, people are quite surprised when sausages and ham have milk in.
So people really need to label check.
Yeah, just checking labels.
Right. Are there any big tips that you would want to give people in terms of that it's easy to live with, any messages you'd want people to have?
As long as you've got a good milk-free alternative, it is easy and you can do it.
Yeah, and do you think it's easier that people change completely to a dairy-free milk for when they're doing things like mashed potato, so they don't mix things up in the family? Would you say that was a good idea?
Yeah, and if you're using one of the milk-free milks from the supermarket, like a nut milk or oat milk, that's fine for your family. But if you've got a small baby and you're using a formula in the mashed potato or to make that custard with, you might want to keep it separate at that point, because it wouldn't really be suitable for the rest of the family to have a baby formula.
No, and you wouldn't do that for a
No.
normal non-prescribed formula. If you'd like any more information about special diets and about a milk-free diet, please look at the County Durham and Darlington NHS Foundation Trust website or go to the British Dietetic Association Food Fact Allergy Sheets.